So we're joined, and I'll continue a little bit later on that, but we're joined by Mr. Murphy from Connecticut. And I mentioned earlier that Mr. Ryan from Ohio has been watching the baseball playoffs. Well, unfortunately, Mr. Murphy from Connecticut is on the other end of that.
Mr. Allmeyer, we needed an off night tonight, Mr. Allmeyer. We got an off night from the playoffs. So those of us that wallowed in the Boston defeat are glad to have a little separation to let our team regroup and rethink how they're going to approach this. Mr. Allmeyer, I just wanted, it's rare that, we have 5 members of the 30-somethings here. It is the 2, new members here. We want to make sure that we understand our place. So I'm going to be very, very brief and just say this, to add on to all the great reasons why we should do this. This is reaching out to families that have done everything that we've asked them to do. They're playing by the rules. They simply can't afford insurance in a market in which, in a state like Connecticut, you're going to pay $8,000 or $9,000 out of pocket before an insurance company picks up $1 for the average family plan that you look at on a lot of these insurance programs. It's the right thing to do because it saves money in the long run, because you're getting preventative care to kids that are going to end up sick and in the hospital later on and end up costing the system way more money because you didn't invest in prevention and you end up paying for crisis care. But I think it's also important to note that this bill is paid for. This bill is part of an effort here in this Congress to advance some of the most important programs to the middle class. We're talking about health care programs, student loan programs, minimum wage, and do it in a way that doesn't add to this enormous, unfathomable deficit that the Republican Congress put us under. Let's just talk about the facts, because Mr. Ryan and Mr. Meek especially talked about this over and over and over again on the floor here. When the Republicans took control, they had a $5.6 trillion surplus that the President Clinton left them with. They have now turned it into, along with this president, a $2 trillion 10-year deficit. Debt, which at the beginning of the president's administration at $5.7 trillion, has ballooned to $9 trillion. So our biggest task here is to make sure that we don't add to that just unbelievable amount of money that this country and every single citizen here owes. And guess what? We are able to do that, to pass a 5-year budget that's going to be balanced after 5 years, to pass a rule that mandates that we don't spend a dime of new money without accounting for how we pay for it. We're able to run the most fiscally responsible Congress that this country has seen in a very long time, while maintaining our commitment to expand programs that help the middle class. And that's what we have to remember when we talk about this S-chip bill, the Children's Health Bill, is that this isn't just more deficit spending. This is targeted spending on people who need it. The middle class.
Will the gentleman yield?
It's paid for.